prescriber has recommended you take Gonal-F Multidose. It'll come to you in a box like this that has all of the things that you'll need to give your injection. I'd recommend you begin by choosing your injection site. This medication is administered subcutaneously, which means it goes into the fatty tissue of either your abdomen or your outer thigh. I generally recommend people take it beneath their belly button, outside an inch or two, beneath and out, or in the outer part of the thigh. Really, this medication can be administered pretty much any place on your abdomen or your thigh where you can pinch an inch just to make sure that it goes into the fatty tissue. Next, open up the box, and the inside will look like this, where there are syringes with needles already attached, a syringe with liquid, and a vial that has powder in it. The powder is actually the medication. To give the injection, just open up the packaging, remove the vial and the syringe with fluid, and take out just one of the syringes that has the needle already attached. Next, you'll remove just the top off the vial by gently lifting it up. Then take the top off the needle that's attached to the syringe with the liquid in it. Put it into the middle part of the vial, into the rubber stopper, and push in all of the liquid. And it will quickly dissolve all the powder that's at the bottom. Remove that syringe and discard this into your sharps container to avoid injury later on. Then you can open up the needle and syringe, remove the cap from the needle, and again place the needle into the midpoint of the stopper, and you're ready to withdraw your medication. Your prescriber will tell you exactly what dosage is best for you. But for today's instruction, I'm going to suggest that your dose is 150 milligrams, 150 international units. You just pull back to 150 on the syringe. If there's a little air in there, no worries. And it's ready to administer. Then you want to choose a place on your abdomen to give the injection. Wipe it one time with alcohol and bunch the tissue up. Remember, you want to pinch an inch. Then take the needle, put it straight into that area all the way. Push the medicine right in. Release the skin, release the plunger, and pull the needle straight out. If you notice a little droplet of fluid or blood on the area where you administer the injection, no worries, just wipe it with an alcohol pad and cover it with a bandage if you need to. When it's time for your next injection, you'll do the same thing, but the reconstitution is already done. You'll simply just take the vial, withdraw the same amount that has been prescribed for you, and administer it just like you did before. Some people opt to alternate sides or sites when you're giving the injections. Keep in mind that the vials and the multi-dose Gonal-F are overfilled, so you'll have more medication than what's actually printed on the bottle. Don't waste that medication. You can still use it. If you have any questions, you can always ask your healthcare provider. But congratulations, you've now given your Gonal-F injection.